The focus on the bone health to me is preventing fracture. So that's primary. So in this 30-year-old woman, assuming that they're already in a healthy bone status, then we're working on strength because we know that there's a strong association between muscle loss and bone loss. So I want loaded exercise. I want them lifting weights in a range of 6 to 12 repetitions where we're really challenging their system. Then also postural considerations, and then balance and dynamic balance, not just standing on one foot balance, because we don't fall stork standing. We fall when we're in movement and doing more than one thing at the same time.
Welcome back, everyone, to the Integrative Women's Health Podcast. I'm your host, Dr. Jessica Drummond, and I'm here with Dr. Lisa Moore and Dr. Margie Bissinger. Welcome, everyone. We're going to be talking today about bone health. And I really want to focus this conversation on sort of the 3 times in life when we have to, the things we can do to optimize bone health. Obviously, the earlier, the better in terms of laying a foundation nutritionally, lifestyle-wise, from a movement and fitness perspective. Then in midlife, as women have our hormonal shifts of perimenopause and menopause, and if something rattles our bone system, whether it's cancer or chronic illness, we want to see what we can do to recover, even if we are postmenopausal. So welcome to both of you.
Oh, thank you so much for having us.
Yes, thank you. It's an honor to be here.
Excellent. So Margie, let's start with you. When we're thinking about bone health from a preventative standpoint, let's say we're talking to a professional or a client in her 30s. Maybe she's in the, premenopausal, but potentially pregnant, optimizing her fertility, maybe postpartum. What should she be thinking about from a bone health perspective?
It's so important, Jessica, because so often people don't. It's the furthest thing from their mind. Their bones really only become paramount, after menopause or if they find out that they have osteoporosis. So it's never too early. I mean, even earlier than that. But a 30-year-old woman needs to, first of all, look at their overall health because whatever they're doing for their fertility and their overall health is also going to help their bones. So if they have underlying inflammation, if they have issues with food sensitivities, whatever it is that they're working on, that's also going to help their bones because those factors can be responsible for bone loss. And a lot of times people don't realize that. So number one, then their nutrition, to optimize their nutrition, make sure they're getting their calcium, vitamin D, vitamin K2, make sure there's not any nutrient deficiencies. And their diet, a lot of people are really not eating a diet that's healthy for their bones as well as overall health. And then I think something that's missing that I know Lisa agrees with me is exercise. This piece of it in terms of they've found very specifically what increases bone and its impact in strength training. So it's working at a much higher level. It's not walking every day. It's not doing yoga, which is all good for you. But if we're really thinking of bones, we want to do high impact and resistance and jumping and things to that effect, which I don't think people realize. Even if they do this twice a week, it can completely it's sort of like a bank. You keep increasing your bone, and then when you're older and you lose it, and around 30, you're starting to get to peak bone density. So the more you can do in terms of the resistance and impact, as well as balance, anything you can do is going to completely, not only change your bones, but your entire life.
That's great. Before we move on to the exercise piece, which I think is very important, let's talk briefly about calcium supplementation, vitamin D and vitamin K, K2 in particular. We know the research tells us that adding calcium supplementation is potentially problematic for vascular health. So Margie, what are some of your best sources for actually getting that calcium in?
It's interesting because most doctors will tell people, all doctors will tell people calcium and vitamin D. That's like the routine. That's typically what the doctor will say. All doctors, conventional. And the problem is some people will think, oh, okay, in terms of the guidelines in America, it's 1,200 milligrams of calcium. But the reality is they found most integrative doctors that that's not necessary. 800 to 1,000 is good. but people
Mhm.
don't realize it's combination. It's from your supplements and your food. And always, everybody always says, even the Bone Health and Osteoporosis Foundation, food first. So
Mhm.
it's so important that people look at their food. I tell them to really see how much they're getting in their food, but subtract high oxalate food like
Right.
spinach, Swiss chard, because that's not going to be usable calcium. So get a good idea of your food and only supplement then what you're not getting. So, I think, subtract maybe the 1,000 from what you're getting that's not oxalate, and then you can supplement accordingly in smaller doses. They have found that people do not absorb more than at least 500 one
Mhm.
time. So I even like to give people smaller doses of that. And the one that I don't like calcium carbonate because people tend to have low stomach acid as it is, and calcium carbonate requires stomach acid. Plus, it can lower stomach acid. So, yeah. So in a nutshell, that's what I tell people. My favorite sources: sardines are great.
Mhm.
I love some of the leafy greens in terms of I love collard greens, using those for
Mhm.
wraps. I love kale. I love bok choy, some of the ones we don't think about, even salmon, even canned salmon that's, wild with the bones. So things like that, you can get a lot of good calcium from that.
That's great. So ideally, we're getting most of our calcium from the diet. Collard green wraps. We have a hack where if we have tuna salad, we always add a can of sardines to it to uh, make sure the kids will eat it and eat the sardines, canned salmon, that kind of thing. And then, if you need to supplement with a small amount of calcium, being sure to balance it with about equal amounts of magnesium, and then getting adequate stores of vitamin D and K2. Are you measuring that roughly annually?
Oh, I think it's so important that people get their, I don't have any, I mean, I always have people work with their practitioner, but you must find your 25 hydroxy vitamin D because you can't guess. And it's so different. Some people have reasons they're not absorbing vitamin D. So to just assume what you're getting from the sun isn't really good enough. And it's not, it comes with, with blood work. It's not expensive. So, and most doctors will check. So I think that's absolutely essential. People check because I see so often, whether it's a genetic, there are some people that have issues with, and then they really are not absorbing vitamin D. And so I think people, when I see it more oftenly than not, they have very low levels. And even though they're taking, 5,000 IU's of
Mhm.
vitamin D. So I think that it's really, really important to measure it and then work with your practitioner on what's ideal for you.
That's great. So, Lisa, you have this same 30-year-old client in your practice, and your goal is to build that peak bone mass. Can you talk specifically about what kind of exercise protocols you would recommend?
Yes, absolutely. The focus on the bone health to me is preventing fracture. So that's primary. So in this 30-year-old woman, we might, assuming they have no risk, but in my practice, it might be a woman that has had breast cancer. So often they will get a baseline DEXA scan to determine that. But assuming that they're already in a healthy bone status, then we're working on strength because we know that there's a strong association between muscle loss and bone loss. So I want them to maintain as much strength and doing weight bearing. What is weight bearing exercise? Well, I want loaded exercise. I want them lifting weights in a range of 6 to 12 repetitions where we're really challenging their system. So, strength training is number one, at least twice a week. I usually recommend 3 because then we'll usually get at least 2, right? And
Mm-hmm.
then we do impact. So we're doing things that increase ground reaction forces, things that increase compression on our bones. So plyometric exercises, impact, skipping, hopping, heel drops, box jumps. So in a healthy young 30-year-old person, these are ways that we can be very proactive in helping them to maintain their bone density, strength, agility, speed, quickness, things that we lose over time, right? And also postural considerations. So, since many of my clients have had breast surgery and surgery for breast cancer, there's often a very protective posture. There's changes in the tissue from radiation that can cause a more rounding or kyphosis in the spine. So, these issues need to be addressed so that we can help them strengthen and maintain better postural positions. And then balance and dynamic balance, not just standing on one foot balance, because we don't fall stork standing. We fall when we're in movement and doing more than one thing at the same time. So we do very high level active balance activities for this 30-year-old client so that they can be very confident doing all the things that they want to do without fear or restriction.
That's great. And, in my practice, I sometimes see an early fracture as maybe from a mild car accident or something as a warning sign of
Mm-hmm.
celiac disease. When I see a lot of patients with endometriosis, which have many other, so endometriosis, I believe, is at least in part an autoimmune disease. And so it tends to be comorbid with other autoimmune diseases like celiac and Hashimoto's. So you have this nutrient absorption problem. Then you have a lot of fatigue. And so with breast cancer, I'm sure you're seeing similar things where you have nutrient absorption issues with the gut and you have a lot of fatigue. So it's hard to start. So let's say we have a client in anywhere from 30 to 50 with the midlife challenges of starting to move into perimenopause and maybe an underlying chronic illness, which could be cancer, could be autoimmune disease, could be some kind of nutrient deficiency in terms of absorption. Let's say they don't have the energy or capacity to do heavier strength training, box jumps. Where might we start?
Oh, absolutely. Wonderful. So we can still start strength training, but we start at a level that meets them where they are. And we're still looking for an intensity that is, that 6 to 12 rep range where they're working enough for intensity. The brilliant part about that and working with my clients who are recovering from cancer is that exercise helps improve their cancer-related fatigue. But we can do it in smaller doses. It doesn't have to be a 1-hour session. It can be a 20-minute session, and we can break it up into smaller amounts. And we're still doing the squats, we're still doing loaded carries, we're still doing postural exercises, but we can take the intensity down. Now, instead of box jumps, maybe we're doing heel drops, or maybe we're just doing a sit to stand that has increased speed. So we're doing, 30-second sit to stand. We're seeing how fast somebody can go. So just changing the speed and the tempo and modifying the load to meet them where they are.
That's great. Do either of you have an opinion on like vibration plates? I've seen pros and cons. What's the research? What's your experience?
I have a lot of experience with it since I use one. Oh gosh, it must be 7 years. So I think it's a wonderful adjunct. There's nothing negative. I mean, they've shown in the research that what happens is that in the bone marrow, the mesenchymal stem cells actually turn into, you have an option, bone versus fat. And they found with the stimulation, a certain stimulation of a certain hertz, so low intensity, high frequency, that it actually changes these mesenchymal stem cells. So that's a wonderful thing. The research has been mixed with the studies. So, I mean, certainly they have done studies on children with, different diseases that they've shown it helps. What I do like, and I've interviewed Clint Rubin, who did the research with NASA, in terms of the one that I'm a big believer in safety first. So I am not an advocate of the high G-force machines that really shake you, because there have been incidences of people getting detached retinas, and we don't want the brain shaking. So I really believe there's certain studies on work-related, vibration, and they found these aren't safe, these high G-forces. So the one I tend to like is the Maradyne. It's a low intensity vibration unit. And I've used that with many people. But to say it's absolutely positively showing increases in bone density, it hasn't. The research is mixed. And I never use it in lieu of. To me, it's expensive. So it's not like the first thing someone should get. But if someone asks me, it's certainly a good adjunct. There's nothing, it's very, very safe. They've tested it on so many people, and the other high intensity G-forces are dangerous. I think we just don't know. And I've been using it with people in physical therapy for years, and people are doing better, but they're doing so many other things. They're exercising, changing their nutrition, getting rid of root causes, dealing with that. So you can't say for sure this works, but I am an advocate because there is research. Animal research is good. And, there definitely is some research on the vibration, how it helps the bones. And I've seen good results with people.
And so if you had a preferred setting in terms of frequency and intensity, what would be your limits? What would
It's already preset. I think I don't want to mess this up. I think it's 40 hertz. Do you know, Lisa, exactly?
I thought it was closer to 30 to 34
I
hertz.
think it's 30 to 40. We can check.
Okay.
We could check that. But I would check if you just the Maridine, and it's I think point 0.4 Gs is what I think it
Mhm.
is. So it's a very low gravity. That's the whole point. It's not high G force, and they found they didn't need that. This certain stimulus
Mhm.
was able to stimulate as I said, the mesenchymal stem cells. So that's what they're looking for. They didn't need this intense vibration that could be damaging. So
Well, that's good because I think my biggest concern was always looking at what is the brain impact to
yes.
that vibration in women of this age. How about you, Lisa? Any experience with that tool?
Yeah, absolutely. Actually, I echo Margie's statements on that. And the research is mixed, but I do think the low intensity vibration has some great advantages as part of a comprehensive plan. With my clients, it's really beneficial also for neuropathy if they have neuropathy from their chemotherapy treatment, and it can be helpful with lymphatic system flow too. So, as part of a comprehensive plan, I think that low intensity vibration is very useful.
That's fantastic. So, actually, I do want to talk briefly about the lymphatic system. So, you work with so many cancer patients that I'm sure you also do a fair amount of lymphedema management and lymphatic systems management. Generally speaking, in perimenopause and menopause, I do a lot of work to the lymphatic system to allow for sort of the day to day detoxification of the environmental toxins that we're all challenged with that are impacting the endocrine system in perimenopause and menopause. So, Lisa, what are some of your favorite strategies for, supporting lymphatic function, whether it's through movement or anything else?
Yes, absolutely. At the very beginning, the very basics, I talk to my clients that stretching and full body movement, even movements is a yoga, but we need to do diaphragmatic breathing and we need to move our bodies in full movements and stretching. So just those simple things, even if they're in pain or uncomfortable, can be incredibly supportive. Aerobic exercise as well. Then I'd also talk about hydration, maintaining enough fluids in their system so that we can have adequate flow, so versus sludge, right? Um, but stretching, even gentle movement is kind of my biggest emphasis. But then we have to really help support our clients and my clients who've had breast cancer at reducing the risk of infection. So skin care is a really important part of that. Only on the involved part of the system that is at risk. So making sure they don't get sunburns, making sure they wear gloves when they're gardening, being careful of mosquito bites and cuts, and taking good care of their skin and preventing infection. It's those small traumas that can create a bigger issue or overload the system. But on top of that, exercise needs to be appropriately dosed. And while it's completely safe for a cancer survivor to go and exercise, and there's no limit to how much they can lift or what they can do, we don't want to overload the system by having someone jump into really vigorous exercise quickly without building up their tolerance to that. So it's just that guided exercise program is a great way to go.
That's great. So it's about really keeping safety
Hmm.
within the lymphatic, well, keeping safety to the skin and to
Hmm.
the, I guess, aggressiveness of the exercise program so that it's slowly progressive. It's taking
Hmm.
their fatigue into account. It's taking potential bone weakness. So, sort of circling back to our original thoughts on this, when people go through chronic illness or cancer treatment, they utilize some of the bone stores of
Hmm.
nutrients and can thus have, be coming out of that treatment with weaker bones. And so we don't want to progress this too quickly. We want to give the bone the time to absorb the nutrients, to remodel, to adapt to the exercise stressor without injury. So, talking about menopause, Margie, when we think about navigating through the menopause transition from a bone health perspective, what are some of the most important things? Because we do know that for women, I believe it's over 75, the actual number one cause of death is fracture.
Oh, so I think with menopause, I think it's an area that for so long, hormone replacement and bioidenticals, people, there was so much fear after the Women's Health Initiative quite a while ago that doctors really stopped even looking into that. But it's an opportunity. It's an opportunity to really balance hormones. And I think it's missed so often because people are afraid. And I don't think in conventional medicine, still, it's not the number one treatment. Yes, you can use bioidenticals and you can use hormone replacement if people have symptoms, but also it's prevention. It's that if people can balance their hormones and many different ways, people, but regardless, if they look at it at that stage before they lose the bone, it really can make a difference. And I think so many people, we really could make a complete change in the trajectory of osteoporosis. So I think it's an opportunity at that point to see how you want to, maximize and optimize your hormones really early on at menopause, where a lot of people wait till later. But even things like stress and cortisol, there's even things in your daily activities that go out of whack that you have control over, that you can do. And there's just a lot. And I think it's something not to just sort of poo poo and, oh, I'm going through menopause. But I think, and I know you teach so much of this, Jessica, I think there's so much, and health coaches and everybody, there's so much we can do with these women in so many areas of their life, with everything, with exercise, with nutrition, with stress control. I teach happiness. So all those things, as well as it's an opportunity that's missed, I feel, with hormone replacement and the bioidenticals. So I think that, it's just something that people don't have to sit and suffer. They can get help, and a lot that can be done.
Yes. I mean, certainly more and more of the research now on kind of revising the poor science that was unfortunately done in the Women's Health Initiative and the benefits of transdermal estrogen, estradiol. That gets slightly more complicated when we begin to speak about breast cancer, Lisa. So while I know that the most recent research has really corrected the kind of, generally increased risk of breast cancer with hormone replacement therapy or estradiol therapies, there still is some, and particularly women who've already had breast cancer or have active estrogen positive breast cancer. What's the conversation like in that world?
To learn some new research at the Bone Health and Osteoporosis Conference a couple of weeks ago, that women that do not have a personal history of breast cancer, though they may still have a family history, can safely take hormone replacement. And so this is still a good conversation that they can have with their physician. So for a long time, if they had a family history, they were hesitant to go that route. But with my clients, they cannot take estrogen, even if they aren't hormone positive breast cancer. They are not recommending hormone replacement for clients who've had breast cancer. So, we have to look at other ways to help create comfort in their body, because often they're also on medications that even suppress their estrogen even further, and then also accelerate bone loss, muscle pain, joint pain. So that's a very challenging question, because they have all the same symptoms of menopause. Often it is initiated early if it was a chemically induced menopause from ovarian suppression from chemo. So that hormone option is often not there. So other strategies, which Margie, you hit on them. How do we reduce inflammation? How do we reduce stress? How do we use movement techniques to help create comfort in the body? Those are all the strategies that I talk about with my clients when hormone replacement is not an option.
Yeah. So, adding that anti-inflammatory nutrition, optimizing nutrient absorption to the level of the bone. Obviously, we've talked about weighting and stressing the bone through strength training, through plyometric training, through vibration training, also balance training. Because when we get to the point, let's say you have a woman who's 60, 65, 70, and didn't have the opportunity to have the support of estrogen therapies to kind of maintain that metabolic and bone building, or at least lack of bone loss, or were pushed into menopause early as a part of the cancer treatment, which we also see with endometriosis. Some of our women are on, GnRH agonists from a very young age. Even hormonal birth control at some level is estrogen suppressive in general. So if someone's been doing that for years and years in their 20s, 30s, 40s, they've lost
Mhm.
that estrogen support, and now they, it's unsafe for them to have that back from a cancer standpoint. That's
Mhm.
when so much of these other tools become even
Yes.
more important. And I think also we need to be talking about balance training. My mom's had two osteoporotic fractures at this point, and both of them were from kind of big falls. Like, she tripped
Mhm.
over a laundry basket, she tripped over a dog, and two women on my street last year had dog related wrist fractures that you could
Mhm.
consider postmenopausal osteoporotic. And while they're somewhat traumatic, if you will, I think there's this fine line we're always talking about, like, is it just because of the osteoporosis, or was there a traumatic injury? If you have a weakened system, even if the injury seems traumatic, it still maybe wouldn't have resulted in such a complicated fracture. Does that make sense?
Yeah, it's interesting because they call it a fragility fracture is the term, but standing from if you fall and fracture standing just at standing height, that's usually attributed to poor bone quality or something going on with your bones. But I did want to mention, if that was okay, one thing that I've seen over the years. I've been doing this for over 25 years, working with people with osteoporosis. And when people do have something, whether it's cancer at a very young age, we don't want fractures because once there's one fracture, your likelihood of another, and it's just saying what's going on with your bone quality. And so to just ignore this is not a good thing. And I'm an integrative health coach, and I'm very much into integrative medicine and doing as many natural things as possible. But I don't want anyone to fracture. And it's very,
Mhm.
very debilitating. The research on fractures and what happens is horrible, the statistics. So there is a place. I really do believe it's very important for everyone to get two tests. One's a CTX and one's a P1NP. They're blood tests. And the CTX will tell them what is going on. Are you actively losing bone? Like, what's going on right now in your bone? And your P1NP. So that's like the osteoclast measure. So for all
Mhm.
the people listening, this is something I'd recommend because we don't know. We just see a DEXA test. We don't know what's happening. Is it that you didn't have bone? Are you actively losing bone? Or you have
Mhm.
a chronic illness? Something's going on, or something happening? Or is it just that, you lost bone? Is it just something that happens? Maybe you had anorexia as a long time ago. We don't know. So the CTX will tell us if we're actively losing bone, and the P1NP measures the osteoblast, the bone building cells. So I think those two tests are just give so much information to people. And if you're getting your first bone density, there's also something called a trabecular bone score,
Mhm.
TBS, which will tell you the quality of your bone. So it's not just giving you a number because two people could have the same bone density. One falls and has terrible fractures, and one is flexible because
Mhm.
they have, it's a healthier bone and the bone quality is better. So anyway, I just wanted to say I wouldn't be afraid of medication because if used properly, if someone has such low bone density, there's now medications that they're called anabolics that build bone, and you can use them short term while you're working on everything else, while you're doing everything, just so that you don't live a life of fractures. And I've just seen that in combination for certain people, if you've already had a fracture, especially, it really can make a difference. So many people said, under no circumstances am I using medication. As the more I've been involved with this, the more I see that doesn't really work because then if they have a fracture, it could have been prevented with a combination. So I just wanted to let people know that don't be closed-minded to using that to get through a certain area if you've really lost a tremendous bone and if you're at risk for fractures.
What about bone stimulators, Lisa? Have you seen that at all?
No, not familiar at all. But I want to make one quick comment, and I'm sorry about your mom, but that
Oh,
highlights
sure.
the point that close to 80 to 90% of all fractures are the result of a fall. So we can make a big
Mm.
impact on preventing fractures by impact our balance training and our strength training. We know there's so much evidence to support those two modalities for preventing falls and fractures.
How about you, Margie? Yes, I agree. That's what one of the things I was wanting to highlight is, even if those fractures were at some level traumatic, as you say, fragility, sometimes, it's not like any of these people fell out of a tree. They were doing like
Mhm.
basic things, unloading the dishwasher, tripping over their
Mhm.
dog. And that's where that balance training
Mhm.
can really be
Mhm.
effective increasingly because, I heard a statistic recently on a podcast that said after age 30, almost zero people ever again sprint. So like we don't get this kind of short burst functional activity. We don't challenge our balance. We don't do some of these things outside of like more formal fitness environments. And so when we're in real life and we get, knocked up by our dog, we can't recover. And I think that kind of training is really important, especially once people are at the point where they've progressed, that the system is fragile. So we need to really protect
Mhm.
it in other ways as well.
I couldn't agree more. It's probably one of the first things I do. And it's something everybody can do because not everybody is in. The good thing about the body is it does meet you where you are. So if you've been bedridden, anything, any type of exercise is more than you're accustomed to. And so the bones respond to forces more than they're used to. So for some person, it might be just doing body weight. It doesn't have to be intense
Mhm.
for them, that's what's so good. You can gain bone from wherever you are. But regardless of that, you made such a good point because falls, the majority of them happen because people fall, fractures. And so in most people, what I have found a lot of times is mindfulness, is that people are just
Mhm.
crossing the
Mhm.
street and they're looking at their
Mhm.
phone and they're thinking about 10,000 things. And that's the first thing I teach people: live in the present, watch because, people just are going on and you're not
Mhm.
watching. And that's when a fall can happen. How sad to have a hip fracture.
Mhm.
And, what 24% now people will die within a year after a hip fracture because you weren't being mindful and you weren't paying attention. But what I've seen, I work with the state of New Jersey and we have certain exercise programs. So what we did, we put Tai Chi in, which has been shown to be so
Mhm.
effective. And so many people came up to me and thanked me, just like you said, Jessica, because in Tai Chi, I think why it's so effective, and they have done research on showing it's effective in reducing falls. And the
Mhm.
reason, and improving balance. And the reason I believe is because you're moving back and forth. You're moving side to side. I mean, things we do in
Mhm.
physical therapy also teach weight shift so that you have these motions in your system. So if you trip, you got this because you've been practicing it. So I can't even tell you how many people have thanked me. They said, I was walking, I hit this rock, but I was able to correct myself. So I think everybody, and just like Lisa said, it's not just standing on one foot, it's the
Mhm.
dynamic balance. And
Mhm.
there's so much we can do. It's not hard. I know they recommend at least twice a week. I like people to do it every single day because it's
Yeah.
easy and it works. I've seen people in their 80s who have fantastic balance. If you don't use it, you lose it. But it's an area that we can really, at any age, start and then keep on progressing so that we don't have to be at risk and we can, make a big, big difference. I think for everybody, it's such an important area that I
Mhm.
don't think people pay as much attention to as they should.
How about you, Lisa? What have you seen in that later stage prevention, balance training? Any, clinical pearls for that?
Absolutely. I love what Margie said. Tai Chi is wonderful, practicing that weight shift, but then we also have speed as we're tripping over that rock or that curb. Can we move our leg with a quickness that can respond? So speed and agility, ladder drills. These are fun things we do, but also how do they do with their eyes closed? What's happening in situations where there's darkness when people are getting up to go to the restroom at night? We can have the exercise safety, but let's put a nightlight there too, so we're not impacting that vision loss. I also do cognitive tasks. So as we get older, sometimes if we're thinking of what we need to get at the grocery store, but also doing something that can affect our balance. So training dynamic balance with a cognitive task or doing dual task activities can greatly enhance the improvement and the benefit. That's what we're doing in our real lives. We are busy. Like Margie said, that mindfulness in our movement, we're so distracted by what's happening all around us. So those are things that I train in my clinic and doing it that way.
Yeah, I love that. And it reminds me, all of this conversation reminds me a lot. I was teaching in China years ago, and just walking around Beijing is like a crazy maze. You'll have a bus and then you'll have like two elderly people, both on one bicycle, and in the park, there are these sort of meetup groups that people are a part of for decades, and they do Tai Chi in the park. They're walking, and even if we look at like rural Mediterranean towns where elderly people walk on cobblestones on a regular basis during the day. I think one of the things I think the conversation recently around children is getting them outside more and playing and climbing and building that physical agility. And I think we have to continue that. The goal is for bone health in particular, build it as children, but then continue it well into older age, walking on stable surfaces, walking and thinking, changing speeds, dealing with obstacles in a way that I think a lot of our modern fitness classes don't challenge, because the environment is almost too stable.
It's such a good point, Jessica. Also, the amazing thing about that, what Lisa had said, and about the dual tasking and learning to do that in a safe environment so that when you're out in the world, but that's what they do with Alzheimer's. I mean, that's how they're really helping people. That type of exercise I found so effective for cognition and keeping yourself, preventing Alzheimer's. So, how great is that? It's good for preventing falls, good for your bones, and also keeping your mind sharp. So it's a win-win.
That's wonderful. All right. So I think to sum up our important clinical pearls in this conversation is, especially for most of my audience who's working a lot with women in their 30s to 60s, is, we have certain nutrients that are very important for bone building that we want to make sure our clients are able to take in. We want to challenge them in a lot of different ways, in a lot of different environments, multi-type tasking, balance training, strength training, and we want to be having a skillful conversation around hormone therapies and really supporting people who lack the ability to either use hormone therapies or who have experienced early menopause due to cancer treatment, or any other kind of chronic illness, because estrogen is such a huge part of bone health as well. All right. Anything else before we wrap up?
I think one thing I just wanted to add for health coaches, where and everybody, I think when you see someone, look at their posture, because posture, as we talked about for a minute before, is so important. And so many of us are rounded, so many people today. And that's going to change your position. When you're rounded, it puts you off balance. So you're more risk for fractures. And it also, in terms of your exercises, you can't even lift your arm. There's so many negative effects of a rounded posture. And there's so many easy things in terms of exercises that people can do. It's just awareness and body mechanics. So I think it's just something, an area that I really believe all practitioners, my husband's a gynecologist, an OBGYN, and I taught him years ago. So every patient he sees, if they come in, he'll mention and let them work on things, because people just don't know. They don't realize. And I think it's an easy tweak that can have profound improvements, because forward bending and rounding increases your risk of vertebral fractures, as you know. So I think just it's an area that we don't look at. And when we're looking at our patients, even measure their height. There's some other tests that people can do. It's called the occipital wall test. So there's some other things that we can do, and even measuring their balance. Really, there's some tests by the CDC. So you could put those things into your practice and completely change people's lives in so many ways. So I just wanted to add that piece.
That's great. Mm-hmm.
Yeah. The other thing is that I talk about with my clients is protein, and how important protein is for building healthy bones. What are those minerals attached to? And they need to attach to that collagen matrix. So I do talk about getting portions of protein throughout the day to help support that. And Margie, thank you for the reminder to sit up straight.
Yes. Yeah. Well, and especially, I completely agree. I mean, we need those amino acid stores. Muscle and bone work so collaboratively together that we have to build strong and resilient muscle. We have to build collagen matrix. This is really the structure of the body. And then to your point, Margie, most people are kind of sitting, behind the desk in that round position, that it's actually the normal position now. We have to work to open that space, open the shoulders. And again, particularly for perimenopausal and menopausal women, when they're also at risk for frozen shoulder due to estrogen deficiency and joint changes, that kyphotic posture, that rounded upper back posture, also changes the mobility of the shoulder. So all very, very important points for that I think are really under discussed in this population.
So true.
Excellent.
Yeah.
Well, thank you so much. I think we learned a lot today. I think this is a very comprehensive this conversation, and all the tools you both shared is a very comprehensive way to help our clients through any stage of life build, maintain, optimize their bone and myofascial structure so that, and have the balance and the cognitive agility to be able to reduce their risk of having a fracture, even having a fall. And then if they do have the fall, have the strength and resilience to either not fracture or recover from that fracture more quickly, even if they're dealing with an underlying chronic illness or cancer. So thank you so much to both of you.
Oh, thank you so much, Jessica. It's
Yeah.
always a pleasure, and good to see you again, Lisa. So, yes, thank you.
Yes, thank you, Jessica, and thank you, Margie. I appreciate you both and what you share in your communities. Thank you.
Thank you. All right. See everyone soon on our next episode of the Integrative Women's Health Podcast. We'll see you next week.